Most men kick off their day with a cup of coffee. But what if I told you that neglecting your penis every morning could be quietly impacting your energy, confidence, and even your ability to urinate comfortably? Hello, I'm Dr. Monroe, a urologist and men's health expert with over 3 decades of experience helping men, particularly those over 60, regain their vitality and safeguard what's essential: their independence, dignity, and health. You might think the penis is just along for the ride as you age, but in truth, it serves as a clear indicator of your overall health, particularly concerning heart health, prostate function, and even early signs of diabetes. The first few minutes post-wake-up are when it communicates with you the most. In this video, I will guide you through 7 specific practical doctor-approved steps you can take each morning to care for your penis. This way you can enhance circulation, prevent long-term damage, maintain sexual health, and feel more in control of your body. Stick around for step 6. Many men skip this one, but it's where we detect early signs of trouble. Catching it early can lead to years of improved function, confidence, and comfort. Before we jump into these essential tips, please hit the subscribe button and turn on notifications to ensure you don't miss any future health advice tailored for you. If you find this video helpful, type 1 in the comments. If not, type 0. Your feedback helps me serve you better. Now, let's dive in. The first thing every man over 60 should do for his penis upon waking is straightforward. Takes less than a minute, but can have a significant impact: a morning inspection. It might sound simple or even odd, but I advise all my patients over 60 to take a moment to observe their penis in the morning, without judgment or shame, just with awareness. I know this may feel awkward initially. We grew up in an era where men didn't discuss these matters. Yet, after over 30 years as a urologist, I can tell you that some severe conditions I've identified began with nothing more than a quiet observation during a morning routine. Infections, minor skin irritations, and even early signs of cancer can present themselves long before any pain starts. Signs such as redness, swelling, small bumps, or unusual discharge are not merely cosmetic issues. They are warnings. If you catch them early, the likelihood of simple and successful treatment increases significantly. One of my patients, George, 67, noticed a persistent patch of dry skin and mentioned it during his checkup. It turned out to be something we caught early and treated swiftly. Had he not looked, things could have turned out very differently. If you are uncircumcised, it's even more crucial to gently retract the foreskin and check underneath. Don't rush. It's just a few seconds of your morning. Think of it like checking your oil before a road trip. It's not a chore. It's smart preparation. Show respect, not fear. Take care, not discomfort. This habit is easy to overlook, but once you start doing it consistently, it becomes second. Nature. The more familiar you are with your body, the quicker you'll notice when something feels off. But that's just the beginning. What you drink before you even step into the bathroom can significantly impact how your entire system functions, especially below the belt. If you're still watching and finding these tips useful, please type 1 in the comments to let me know you're on this journey with me. Now, let's move on to the second essential step. Hydrate before you urinate. For most of my life, even as a doctor, I would wake up and head straight to the bathroom without a second thought. It was a habit. Feel the pressure, and your body says, go. However, over the years, while working with thousands of older men, I noticed a crucial pattern. The men who stayed sharp and experienced fewer urinary issues as they aged shared one common habit. They drank water before heading to the toilet. It might seem counterintuitive to drink water when you already need to go, but here's what happens. After 7 or 8 hours of sleep, your body is naturally dehydrated. Your blood thickens, circulation slows, and your kidneys are operating with limited resources. That first glass of water gently wakes up your system, signaling it's safe to flush out waste, and importantly, it helps rehydrate your pelvic region and stimulate blood flow, including to your penis. I've had patients tell me that they adopted this small habit and noticed improvements in flow, less straining, and even better morning erections within weeks. It's like priming an engine. You wouldn't run your car dry after a cold night, so why do that to your own body? I typically keep a glass of room temperature water on my nightstand. So before my feet even hit the floor, I'm giving my body what it needs. Try it. You'll be amazed at how quickly your system responds. Now that your body is waking up inside, let's discuss how to get your blood flowing outside. And no, you won't need a treadmill or gym shoes for this next step. Do a 60-second warm-up. Stretch. I used to think stretching was solely for athletes or yoga enthusiasts. But as I aged, I noticed how stiff my body felt each morning, not just in my back or knees, but in my blood flow or lack thereof. I realized that moving a little in the morning didn't just loosen my joints. It made me feel more present and alive. And importantly, it supported circulation in the pelvis and groin. The penis is a vascular organ, meaning it relies heavily on blood flow to remain healthy and function properly. After lying still for hours, especially as we age, circulation to the lower body slows down. A light stretch for just 60 seconds can fix that. You don't need to be a gymnast. I simply stand next to my bed, take a deep breath, lift my arms, and gently twist side to side. Then I lift one knee at a time, marching in place. It gets the blood moving, wakes up the nervous system, and provides gentle stimulation to support healthy erectile function and urinary control. Many patients report feeling significantly better. Just from this simple practice over a week, they experience stronger flow, fewer bathroom trips, and increased confidence at the start of their day. It makes sense. When the engine warms up, it runs better. Now that we've got the blood moving, there's one morning signal that offers a valuable insight into your health, one many men notice but seldom understand. Let's break it down. Point. Number 4 is something many men overlook, but it can reveal more than you think. Check your morning erection and what it means. I'll be honest. This is the part where most men either get uncomfortable or make a joke and change the subject. But as someone who has spent decades working with men just like you, I want to stress that your morning erection is not a joke. It's one of the most honest indicators of your overall health, particularly regarding your heart, hormones, and nerves. You don't need to obsess over it. Just take note. Did it happen today? Was it as firm as it used to be? Did it fade quickly or linger? That's your body communicating with you. When you wake up with a healthy erection, it signals that blood flow is functioning, testosterone is circulating, and your nervous system is intact. If this signal goes missing, especially over time, it could indicate a deeper issue. One patient, Ray, 72, hadn't had a morning erection in over a year. He assumed it was just part of aging, but after tests, we discovered early signs of cardiovascular disease. We caught it before it escalated into something serious, thanks to one symptom he nearly ignored. I know discussing this isn't easy, but when men pay attention to this signal, they often feel more in control, less like they're merely aging, and more empowered regarding their health. Now let's move from observation to action, as what you do in the shower each morning can either support or undermine your efforts. Step 5. Clean, but don't overdo it. For years, I believed a strong soap and hot shower were the best way to start the day fresh and clean. I scrubbed every part of my body as if it were a car wash. However, as I aged and saw hundreds of cases in my practice, I realized that regarding the penis, more isn't necessarily better. In fact, being too aggressive with cleanliness can lead to more issues than it prevents. The skin around the penis is thin, sensitive, and protected by natural oils and bacteria that maintain balance. Harsh soaps, hot water, and excessive scrubbing can strip away that protection, leaving it dry, irritated, or cracked. Over time, this can lead to infections, rashes, or discomfort that seemingly appears out of nowhere. I've treated many older men who came in with redness or burning, thinking it was something serious, when in reality it was just from overwashing. Now, I recommend using lukewarm water and a mild, unscented soap. If you're uncircumcised, gently retract the foreskin and rinse underneath. No force, no rush. Like brushing your teeth, it's not about how hard you scrub, it's about doing it correctly and consistently. Treating your body with respect carries a quiet dignity, and these moments of care in the shower, done with mindfulness rather than autopilot, set the tone for how you treat yourself throughout the day. When you care for yourself without shame, it transforms how you navigate the world. Now, let's address what happens next when you sit down to eat. It can either support your efforts or gradually undo them. Step 6. Fuel with a penis-friendly breakfast. I didn't grow up thinking much about breakfast. Like many men of my generation, I grabbed what was quick and familiar: eggs, toast, maybe bacon, if I was lucky. It wasn't until later, both as a doctor and as a man aging myself, that I grasped how powerful that first meal is for protecting sexual and urinary health. What you eat in the morning directly impacts your hormones, blood flow, and even prostate health. The standard American breakfast, loaded with processed meats, sugar, and refined carbs, isn't doing us any favors. Foods high in saturated fats and sodium can lower testosterone levels and impede proper blood circulation to sensitive areas, like the penis. These days, I start my mornings with oatmeal topped with walnuts, chia seeds, and blueberries. Sometimes I add a hard-boiled egg or a slice of whole-grain toast with avocado. This type of breakfast provides essential nutrients such as omega-3s, antioxidants, nitrates, and zinc to support erections, energy, and long-term vitality. One patient, Thomas, 68, made this one dietary change for a month and returned to tell me, "Doc, I didn't realize food could make such a difference down there." And it truly can. If you've never considered what your penis desires for breakfast, it might be time to start, as small changes at the table can lead to significant improvements elsewhere. Now that your body is fueled and ready, let's tackle a habit most men overlook, which is gradually working against them: where and how long you sit. Step 7. Sit less, move more. I remember the first time I really noticed it, how stiff my hips felt after a long breakfast while reading the paper. Initially, I didn't think much of it, but day by day, I began feeling increased tension, sluggishness, and even unexpected numbness. That's when I began exploring the connection between prolonged sitting and men's health, and what I discovered changed my daily routine for the better. When we sit for extended periods, especially in the morning when blood flow is already sluggish from a night's sleep, we apply pressure on the pelvic floor muscles, restricting circulation to the lower body. For older men, this lack of blood flow doesn't just affect comfort. It impacts erections, urinary control, and long-term tissue health, even increasing the risk of pelvic floor dysfunction, something most men don't hear about until they start experiencing symptoms. What helped me and many of my patients was surprisingly simple. I began setting a timer to get up and walk for 5 to 10 minutes after breakfast. Not a workout, just a gentle stroll around the house, out to the mailbox, or even down the hallway and back. It sounds small, but it wakes up your circulatory system, reduces pelvic congestion, and ensures everything down there functions as it should. One man said, "That little walk made me feel like my old self again." I believe him because I felt it too. We weren't designed to sit still all day. Our bodies are meant to move, and that movement helps maintain strength, function, and dignity into our later years. Now that you've made it this far, I want to leave you with something more profound. There's one last layer we haven't discussed yet. It's less about your body and more about your internal feelings. Final thoughts from Dr. Kara. If you're still here with me, thank you, not just for watching, but for caring enough about yourself to listen. This is the part that often goes unspoken. For many men, especially those in their 60s, 70s, and beyond, the idea of paying attention to your body, particularly your penis, can feel uncomfortable or even unnecessary. But the truth is, it's one of the most self-respecting things you can do. Each of these 7 habits we discussed, starting your day with a quick inspection, hydrating before urinating, stretching to boost circulation, observing your morning, erection, cleaning gently, eating mindfully, and simply moving more, aren't flashy medical procedures. They're quiet, simple acts. But together they send a message to your body. You're still here, still paying attention, still invested in your health. I've sat across from numerous men who thought change was impossible or that discussing these issues was too awkward. I've seen them regain strength, improve function, and rediscover parts of themselves they thought were long gone, not due to a miracle drug, but because they started listening and caring. You don't have to be perfect. You don't have to solve everything overnight. But if you begin small and remain consistent, your body will respond in ways that might surprise you. Your health, confidence, and sense of control are still attainable. You just need to decide you're worth the effort. If this video resonated with you, consider sharing it with a friend or leaving a comment below to let me know which tip stood out to you and what you'd like to hear more about in the future. Your story matters, and it's never too late to embark on the next chapter. If this content helped you in any way, please give it a like. It lets me know it's meaningful. Share it with someone who might be quietly dealing with similar concerns. Love to hear from you in the comments. Let me know which tip you'll implement tomorrow morning or ask me any questions. I read every comment. Don't forget to subscribe and turn on notifications so you never miss new advice tailored for your health, confidence, and quality of life. You are not alone on this journey.